The Lagos State University Teaching Hospital has been trailing the blaze in delivering cutting-edge healthcare solutions in the past 50 years. Today on Soundhealth, our focus is on how the hospital has transformed. I am Olasumbo Modupe. Thanks for staying with us. We begin with COVID-19 updates.
Over 500 deaths have been recorded so far at various isolation centers across Lagos State. Commissioner for Health, Professor Abayomi, who revealed this, added that the COVID-19 third wave that Lagos and other parts of Nigeria are experiencing was as a direct result of the importation of cases from other countries, tagged red-listed countries, where the pandemic is very active, like South Africa, India, Brazil, and Turkey. Since the commencement of the isolation of passengers from the red-listed countries, the Lagos State response has successfully quarantined 4,448 passengers as at August 19, 2021, and identified 58 passengers of interest, POIs, who tested positive to the COVID-19 virus despite a negative test on arrival, and who have hitherto contributed to the ongoing third wave, which has claimed over 500 deaths at our isolation centers. He further added that the state government's conviction of ensuring public health, security, and safety outweighs any other consideration, as defaulting international travelers would be prosecuted accordingly. The National Primary Healthcare Development Agency has advised all persons 18 years and above who wish to receive the COVID-19 vaccines to register online in preparation for the commencement of the exercise. The agency says the registration platform captures data and takes care of seamless schedule ahead of the exercise.
It is still Soundhealth on Lagos Television, speaking more on Lagos State University Teaching Hospital's feat in delivering unparalleled healthcare to the public is Professor Adetokunbo Fabamwo. He is the Chief Medical Director of the hospital. Welcome to the program, sir.
Thank you very much.
All right, the hospital was established in the 50s. Let us know more about the hospital's mode of operation. Is it just about a training institute for doctors?
Thank you very much. So let's go back a bit into history. What constitutes the present Lagos State University Teaching Hospital actually started as a cottage hospital in the 40s, in the colonial era, pre-independence era. And from there it developed into a general hospital in the 50s, 60s, and in the year 2001 it was decided that the General Hospital Ikeja, as it was then known, was going to be used as the teaching hospital for the College of Medicine that had been established in 1997. So in year 2001, the General Hospital Ikeja was renamed Lagos State University Teaching Hospital, and it was to be the sister teaching hospital for the Lagos State University College of Medicine, so that the students who are now ready for clinical studies could come to the hospital for clinical experience. Meanwhile, clinical lecturers had been employed, lecturers who are going to teach them within the hospital setting. And so from 2001 and now to 20 years down the line, the Lagos State University Teaching Hospital had evolved from a rudimentary teaching hospital into what you can now call a superstar tertiary center. And that is what we're engaging the press and the media about, to let them know what we are capable of doing. You recall that It is usually said that if you wink in the dark, you know what you're doing, but nobody else knows what you're doing. And so from the experience of our successful open heart surgeries that we had been doing, and then the comments of people who kept saying, oh, we didn't know that this kind of facility is available in your hospital, we wouldn't have gone abroad, etc., etc. So we felt that there's a need to tell the world about what we're capable of doing in Lasuth, and also talk about some of our challenges, some of our aspirations, some of our prospects, and some of our hopes. So that's essentially why.
Now, in your response, you mentioned some of the feats recorded by the hospital. Now, what sets the hospital above par?
The first thing that sets the hospital above its counterparts is Mr. Governor of the Lagos State government. Mr. Governor, Mr. Babajide Olushola Sanwo-Olu. And the reason is that he had been of monumental support to the hospital, especially in terms of financing. The governor had been very supportive. He had said on assuming office that he was going to ensure that this teaching hospital attains greater heights, and he had been putting his words into action by the release of funds for us to do a lot of things. Secondly would be the Honorable Commissioner for Health, Professor Akin Abayomi, of course, who superintends over the affairs, whose ministry superintends over the affairs of the hospital. He also had been very supportive. He believes in our dreams and our visions, and he had always been by our side. Thirdly would be our management board, our governing board. We have a governing board made up of a lot of excellent people who came from the private sector, and they've brought in a lot of private sector initiatives into what we are doing here. The board is headed by Dr. Richardson Ajayi, who is the chairman of Bridge Clinic. If you recall, the Bridge Clinic is a very highly successful assisted reproductive health center, and so with all that experience on board, they've been driving change in this hospital. And of course, we can try to be a bit modest, but I mean, not much will happen if you do not have a competent management. So we have a competent management in place, headed by my good self, and I'm assisted by a lot of other people. Our Director of Clinical Services and Training, Professor Adekoya, and other major officers who assist us. And a staff, a core of staff who are willing to move along a new direction. Okay, so those are the components of our success story. Those are the major components of our success story so far.
Share with us some of the feats the hospital has recorded.
Thank you. Performing open heart surgeries is not yam and egg by any dimension. These are surgeries in which you literally have to stop the heart from beating, and then use a machine to perform the work, the functions of the heart, while you repair different types of damages that have happened in the heart. And when you've finished, then you now start the heart to beat again, and it's like magic, and it requires a lot of skills, it requires a lot of competence. Our story about open heart surgery dates back to like about 16 years, when we used to bring in missionaries from the US who would come with their whole team, and we would have lined up cases for them. They would come, they would operate on the cases, they would go back. And then that's the end until they come again. Another mission. So we got tired of that. So we encourage our cardiothoracic team to start improving their skills, to start understanding these missioners whenever they came, so that they will get skills. We also made sure that the missioners allowed our surgeons to have hands-on training, you know, on these patients. So like about 3 or 4 years ago, we were able to achieve total independence from these missions. And so our surgeons are now capable on their own, without any external assistance, carry out open heart surgeries. And they've been running regular surgeries on a weekly basis. That is the first aspect. The second aspect of it is about the cost of the surgeries. In order to get an open heart surgery done, either in India, the UK, the US, you would need about 10, 12, 15 million naira minimum. But with 2 million naira, you can get an open heart surgery done in Ikeja here. 2 million naira is a bit subsidized. Okay, the state government is able to come in and subsidize this treatment for all this, and most of the patients that need open heart surgery, really they are indigent, you know, so we're able to contribute to the needs of the indigent in the society, the health needs. Now, what other things are we doing?
Cochlear implant.
Right, so, yeah. Now, concerning the cochlear implant, we are one of the very, very few centers in sub-Saharan Africa that will be able to do cochlear implant. And what cochlear implant means is that people who are completely deaf, with the insertion of these implants, they are able to hear again. Again, this is a highly sensitive, highly complicated procedure. And the story of cochlear implants is almost the same as the open heart surgery. We had people who came in, you know, expatriates who came in together with ENT surgeons. They did these procedures and left. But over time, our surgeons have learned they can now do it on their own, and indeed they are doing it on their own. Renal transplantation, this is a common procedure in which you would need to use a donor kidney to replace a damaged kidney. These are procedures that are only done commonly abroad, India, US, UK. Now, I must confess that there are 1 or 2 centers in Nigeria that had beaten us to the regular performance of renal transplantations. There is a center in Abuja that does renal transplants regularly, and I know about the Ile-Ife program. You know, the University Teaching Hospital in Ife, they also do regular renal transplants. So we have joined that league of hospitals that are doing regular renal transplantations. So again, people don't need to travel abroad to get their kidneys fixed, and so on and so forth. We also are now in a position to do pinhole surgeries for a lot of surgical and gynecological conditions. And what do I mean? The world has gradually moved away from the era whereby to remove any tumor in the abdomen, you have to open up the abdomen wide, and you know, patients spend a long time in the hospital. They have a long scar to show, you know. So the world has moved on to what we call operative laparoscopy in order to remove tumors, and these are procedures that we carry out in our surgical departments and in our obstetrics and gynecological department. We are into assisted reproductive health. We do have an Institute of Fertility Medicine here, where we can do in vitro fertilization. The center is about 10 years old, And the last time that we counted, we had produced about 150 babies from in vitro fertilization. Now, the beauty of our program is the cost. It's a private public partnership between our hospital and a very well-established IVF center, which is the Bridge Clinic. The Bridge Clinic came in to us about 10 years ago and said they wanted to perform corporate responsibility. They wanted to put back some of what they have benefited from society. So by offering in vitro fertilization at highly subsidized rates. So our program does IVFs for about 50% of the cost on the streets. So we are running that steadily. However, there are caveats because we do not want people to take advantage of that program, people who can normally afford to go to the centers that do it for the normal prices. We don't want them to come and capitalize. So there are checks and balances to ensure that before you are offered a service, you must show that you are really not a high income earner. You know, so there are ways that we do that. Now also we have one of the best critical care units in sub-Saharan Africa. Our critical care unit is ultra-modern and it caters for the needs of critically ill patients. A lot of patients who need ventilator care, who need acute monitoring, you know, the patients that would normally have been transferred abroad for treatment, we are in a position to look after them. And so our critical care unit had been in existence for about 15 years. But in the last 5 or 6 years, it was remodeled and upgraded. So we now have a new critical care unit with about 12 ventilator spaces and about 20 private rooms. We have intensivists, you know, these are specialized anesthetists who look after the patients. And we've been offering very excellent care to a lot of critically ill patients. Now, again, the beauty of our critical care unit is about the cost. The beauty is about the cost. While it will cost you an arm and a leg to get your patient admitted to any of the private intensive care units, for pittance, you will get admitted into Lasuth critical care unit. Why? We're a government establishment. It is a unit that was set up for the people of Lagos, and we know that the people of Lagos are made up of the haves and the have-nots. So we should be able to take care of everybody who needs critical care. So that's what we are set up to do, and that's what we're doing. We also have started developing what we call a cardiac catheterization laboratory. A cardiac catheterization laboratory is a place where some life-saving procedures are carried out. Life-saving procedures including procedures to save a patient, for instance, who has suffered a heart attack, from dying. Procedures to save a patient who has had a pulmonary embolism, you know, to survive. The whole idea is to chase that clot that is blocking that artery and remove it. We will be able to do that once this lab comes up. It's in process. We already have interventional cardiologists on ground. These are cardiologists, but who have advanced training and skills in interventional procedures using a cardiac cath lab. Also, our ultra-modern endoscopy suite, as well as a row of dialysis units, will soon be ready. It's under construction. When it's ready, we'll be able to do investigative procedures to look into the gastrointestinal tract. We're already doing, but we are developing a more modern suite to carry out those procedures. So, on dialysis for renal patients, we will be able to do more of them when our suite is ready in about 4 weeks' time. Then, need I talk about some of the advanced procedures that we carry out in our eye clinics? Need I say that we are able to offer laser surgery for some eye conditions in our eye clinic? All right, we are able to offer also treatment for glaucoma using modern methods. So these are some of the things that we've done concerning clinical services. There are other things which we'll still talk about.
Lasuth is a government-owned hospital, and most times you hear people say it's a government hospital, services are supposed to be free. So I'm going to ask you, although you've said most of the services, most of the costs have been subsidized now, are services truly free or affordable?
The difference between free service and affordable service. Since all my years in Lagos State Health Service, I have never heard about free service. I know about free health for certain categories of people during the Second Republic, but I believe that has really fizzled out over time. What is in place now, which is commendable, is the state health insurance scheme. Okay. And it gives me great joy to be able to seize this opportunity to speak a bit about the state health insurance scheme, because nilly-willy, it impacts on access to health service, it impacts on ability of health institutions like our own to be able to give service. And the state health insurance scheme is in place. But unfortunately, the uptake has been very low. Our people need to key into the state health insurance scheme. And health insurance works in a very wonderful way. You pay a little sum of money. You may not access the health, but when you need to access the health, whatever it costs you accessing the health service, over and beyond what you paid as premium, you do not have to worry about that again. Okay, so that's the way health insurance works. And I'm going to seize the opportunity to call on the citizens of Lagos to register for the state health insurance scheme. That is the way forward in any healthcare delivery system that wants to make progress. Health insurance is the way forward. You don't forget that health costs money. And the reason why you cannot ever talk about free health, there's no concept like that. Okay? Because at the end of the day, somebody will pay for that health that you are calling free. Somebody is going to pay. Now, it's either government or the individual.
What is the hospital doing to improve on services, patients, welfare, especially negligence and response time, to enhance response time?
We're a teaching hospital, but believe it or not, we are only 750 beds. And it has become clear that this hospital is offering more care than it was set up to do. A cottage hospital of 100 beds that has now evolved into a 750 bed hospital. Clearly we are doing much more than we were set up to do. Therefore, we need to expand. We need to have more bed spaces. So luckily for us, we have a building under construction, which was a donation by the Sustainable Development Goals via the SSA to the President, former Deputy Governor of Lagos State, Mrs. Adetokunbo, was able to engineer the donation of a 120-bed building for us, which is going to comprise of rooms, wards. It's under construction. It's about 40% constructed as we speak. We were hoping it would be commissioned in September by Mr. Governor, but it looks like it may spill over to the new year, 2022. But when that building comes up, we're going to have additional 120 beds in the hospital. So our space problem will be partially solved. You may have been hearing of stories of people who brought emergencies here and were not able to be admitted because there was no bed. This is because one, the volume that we're carrying is heavy. Two, a lot of emergency cases that are brought here are not really supposed to come here. From our statistics, we've found out 80% of emergency cases that are brought here could as well have gone to any of the other general hospitals. And there are 27 of them. 27 general hospitals. Bagada, Orile Agege, Surulere, Onikon, they are all over the place. Most times waiting for work. Okay, so but everybody wants to come to Ikeja. Everybody wants to come to Lasuth. So that explains why sometimes we are unable to admit all the patients that come here for admission. But we have a policy. We don't just turn people back. We'll carry out a first aid on the patient. If we need to set up a drip, we'll set up a drip. If we need to put them on oxygen, we'll put them on oxygen. Then give them a letter of referral to wherever they need to go. Now, the reason why patients tend to go from one place to the other and so on before they get admitted is because the communication policy that we had some years back collapsed. Some years back, we had a sort of communication policy whereby we were in a position to phone Bagada and say that I have this patient, I don't have a bed, do you have a bed? Oh yes, I have a bed, let him come. And then they go straight to Bagada. But that system collapsed. So now it is just trial and error. I write a letter and I refer you to Lasuth, I refer you to FMC, Butemeta. I really don't know if there's a bed for you there.
What can be done to revive?
Right, that discussion is on. I can assure you of that. Just about 2 or 3 weeks ago, the Honorable Commissioner and I had a conversation around this. And a decision has now been taken to resuscitate that system, whereby all hospitals in Lagos State will be interconnected by radio phones, so that we are able to call each other to find out whether there are bed vacancies or not. The challenge will be the federal hospitals. How do we bring them into the hub? That is Lasuth and FMC, Butemeta. We need to have discussions with them so that we put them in the loop, because it's only by putting them in the loop that the system will be complete.
All right, so I would like you to use this opportunity to let members of the public know the requirement for admission for referrals now, because like you said, everybody wants to come to Ikeja. Are there requirements for?
Some years back, the former governor of Lagos State, His Excellency Babatunde Raji Fashola, promulgated a policy whereby cases that will come to Lasuth would always be referred cases, that no case should come to Lasuth just on their own. You must come with a referral letter from either a private hospital or one of the government hospitals. But unfortunately, it was just a mere verbal promulgation which never became documented into a law. So, of course, it's not really happening. But at our own level, we've tried to insist that we would only attend to cases with referral letters, because that's the way it's supposed to be. We're a referral center. We're a tertiary center. We are not a center where people will just say, I'm going to Lasuth because I want to be in Lasuth. So, but it's fairly difficult to insist, because sometimes some patients are so ill that mere seeing them, you won't be able to put your foot down. You just have to admit them. So I think the way forward concerning that is for the present government to make that policy into law, so that we'll have a little relief. We'll be able to concentrate on our core functions, the things that we are set up to do, which are advanced treatment of cases. Then let's talk about our happiness meters, because you see, when we are doing all these things, you should be able to also measure objectively what your patients think about your services. So we have been able to put in place some
Parameters.
some equipment which are computerized equipment and which enables patients who have accessed our services to give their opinion about what they think. And yes, straight away. And then automatically the report they give is collated and generated. So on a daily basis, we are able to say that 50 patients came to Lasuth. 10 of them are very happy with your service. 15 of them are just fairly happy. 12 of them are very angry with you, something like that. We're able to, and that assists us to measure our performance in terms of service delivery. I think we're the only hospital in the whole of Nigeria that has those equipment in place for now.
All right, apart from bed spaces, the issue of bed spaces, now what are the other challenges experienced by the hospital, and how have you been able to overcome that?
Good. We had a serious problem with parking in the hospital. Parking in these premises was very chaotic. Computer village traders came early in the morning and they would park their cars and fill all the spaces. And they would not come back until 10, 11 to remove their cars, thereby leading to a situation where doctors came in, nurses came in to do their work. They had nowhere to park. People traveling through the domestic airports would park their cars and go to Abuja for 1 week, 2 weeks, knowing fully well that their cars are very safe in here. And they don't want to pay the charges that at the airport. You know, people who sell cars would park fairly used cars here and bring in customers to inspect them. They turned Lasuth into a car slot. So there was a need for us to address that. So we engaged a parking consultant. After a series of investigations and consultations, and these consultants are the same people that manage the parking system at ShopRite. And so now we have a sort of pay parking system whereby in order for you to put your car in Lasuth for a prolonged, then you will pay. But for people who come in to do quick business, 1 hour, 2 hours, there's a free window in which you don't have to pay. Okay, because we recognize that we're a public place, we recognize that we're a hospital, so we have that free window. Just do your business quickly and then you leave. You don't need to pay. But if you are going to put your car here for a prolonged time, then you are ready to pay. Since we started that system on the 1st of May, we have noticed a marked improvement in the orderliness of the whole premises. Also to say, for us, it's not a revenue generating venture at all. You know, we're not making a kobo out of it. It was just to bring in a parking manager for our chaotic parking system. I'm going to this length because I know that the system was criticized, people spoke against it, and gradually we've been able to explain why we have to do this. We've been able to assure them that if you come in just to conduct your quick business and leave, then you don't have any fare, you're not paying anything. So that has assuaged the feelings of a lot of people. The other challenge, major one, would be this armada of immigration of health workers. Totally beyond our control. If a man feels that he would find greener pasture elsewhere, you can't stop him. There's freedom of movement. So what has been happening in the last 2 years or so is that a lot of doctors, a lot of nurses, on a daily basis resign our appointments to travel abroad for greener pastures, thereby leading to a big gap in staffing. Even though, to be fair on the government, we have a policy in place which is called an exit replacement policy, in which we are able to recruit to fill in the spaces of members of staff who left us. However, sometimes you don't even have enough people when you advertise and call for applications. The last exercise we did about 6 weeks ago, we needed nurses, to fill in the slots of those that had resigned. But honestly, we didn't get enough applications because even young nurses are busy in business centers filling forms for Canada, for UK, looking for jobs abroad. They don't want your job. So staffing issue, but I'm happy to announce or to say that just 2 weeks ago, again, Mr. Governor came to our rescue by approving a massive recruitment plan for us. In total, we're going to be recruiting about 450 new staff in the next 1 or 2 weeks. Our strategy this time around is to advertise widely so that we can get enough applications for the positions. We're going to recruit 20 additional consultants. We're going to recruit 150 resident doctors. And we're going to recruit about 200 new nurses. So hopefully we will have a good state of staffing when this is done.
All right, now that the state is in its third wave now, I know the Lagos State government sets up an isolation center here in Lasuth. Is it still operational?
No, well, it is not correct to say that we have an isolation center. We do not have an isolation center. Okay. We have a holding bay. All right. There's a little difference between an isolation center and a holding bay. In an isolation center, you keep confirmed COVID cases, okay, and treat them. In a holding bay, you keep suspected COVID cases. You investigate them. When you confirm that they are truly COVID cases, you move them out. But the beauty of a holding bay is that it has individualized cubicles. Thereby, if you keep a COVID positive patient next to a COVID negative patient, there is absolutely no risk of the positive infecting the negative. So that's why we're able to keep suspects. Okay, and you see, during the height of the pandemic, a lot of patients suffered. Why? Because they had COVID symptoms, but they were not confirmed. They hadn't done any test. So any hospital they went, the hospitals were scared to admit them because they had COVID symptoms. You know, so they went from place to place. Some of them just died without being admitted anywhere. But with a holding bay, you can keep such patients because they will not constitute any danger to other patients. And then you do the test, and if the test comes out positive, then you can send them to any of the other isolation centers. Okay, back to the holding bay. It is still in operation. As a matter of fact, it is now undergoing a major renovation. Don't forget that it's a temporary structure, and it was built over a year ago. Again, it was a donation by one of our benefactors. Okay, it's a 50 million naira project. It was a donation, and but over time, it had deteriorated. So again, I have to thank Mr. Governor, who approved funds for us to rehabilitate the holding bay. So as we speak, there is some rehabilitation going on in the holding bay, but it hasn't stopped the function of the holding bay. We are still keeping patients there. The rehabilitation is being done in a segmental fashion. You know, move patients here, fix this place, move them back, fix that place. So that's what we're doing, and we are happy that we've been recognized as one of the COVID response centers for the state. And we're also happy that the Honorable Commissioner for Health gave approval that our patients can get some oxygen from the oxygen plants of the state, rather than what we were doing before, spending our own money to purchase oxygen for their use. So we're good.
That was Professor Adetokunbo Fabamwo, the Chief Medical Director, Lagos State University Teaching Hospital, Ikeja, on providing high-quality tertiary healthcare services to patients across the country. This is all we have time for today on Sound Health. Whatever the health condition, seek medical help early enough. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.